Hi everyone, welcome to our weekly Medmentor clinic. We're live as ever on 6 o'clock on Saturday, and I'm here to answer all your questions about life as a med student, about the medical school applications process, gives you guys hopefully giving you guys tips and advice that you can take away and use to get yourself into med school. So looking forward to today's session. Last week was a lot of fun. I think a lot of you guys started engaging with the comments and the questions. So if you've got any questions, drop them below on the comment section or through a quest card, and let's have a conversation. So we've had a few people already join. So Sophie, Hogan, Paul, Ali. Hey Ali, it's nice to see you again. Hi Paul, welcome to Medmentor Weekly, to our weekly clinic sessions. We've got Ali, Caitlin, Rocky, and Zoe. So we've got plenty of people joining. Cool. So let me just introduce myself. So my name is Tafsir. I'm a final year medical student at UCL, and I am part of Medmentor, where we're an organization that want to help you guys get into medical school and cut the barriers to access and the cost to that. So we do everything for free. And hopefully you guys have already started gaining from our website, the stuff that we've got on social media. And what we do here is answer your questions directly about the med school application process and troubleshoot them. So as I was saying, I'm part of Medmentor, and I've also been a interviewer at UCL Med School for the interviews there for the last 2-3 years. I've taken a lot away from that because obviously we get to see how life is like on the other side of the table, what we're looking for in a medical student in terms of general, all medical schools in general anyway. And I've been part of UCL Target Medicine program as a mentor for the last 6 years as well. So I've learned from a lot of my mentees who have gone through the process, like you guys are going through now. So got loads of tips to share with you guys, hopefully. So let's do it. All right, just having a look. So we're live also on Instagram, YouTube, Twitter, and on our website. I see there's 2 people who have joined us from the other external groups, and we've got a few of us already on Instagram. So let's start. Ali, thank you for your question. Really appreciate starting off with. So Ali goes, "Hi Tafsir, I'm doing Oxford outreach program for Bengali and Pakistanis. However, it's quite consuming attending all the sessions. I'm not considering Oxford for medicine since it's traditional. Do you still think I should do it?" So number one, I think I'm a bit biased because I know a few people who have started the Oxford outreach program for Bengalis and Pakistanis. I think Ibs is someone who was behind all of that as well, from what I know. They're doing a good job, but of course this is Oxbridge related, and if you don't think something in general is worth your time, value your time because it is useful, especially later on as you go in your career. And I think you need to reflect and see if you're taking anything from it. If you're taking something from it in order to put it on your personal statement, see will it actually add much compared to what you're taking from it, because what you're taking from it is the most important, and hence why you're supposed to put it on a personal statement or talk in an interview about it. So if you're not taking much from it and you're not applying to Oxbridge, then you don't need to continue. However, if you still think that there's an inclination that you might apply, then obviously stick to it. So Ali, obviously I don't know your scenario completely, but as you're saying, you're not applying to Oxford. I don't know exactly what they do, but I'm guessing it's very much more Oxbridge focused. But a lot of outreach programs want you to apply to universities in general and for your course. They might help with a few things there. So see what more you can take, and if you're kind of fed up with it, then of course, I think it's one of those things. It's better to quit whilst you're ahead. Hey Medinotes, it's good to have you on. Thank you for saying hello. Do we have anyone else with questions coming in? All right, I'm looking at the question cards. Nothing of note at the moment. So 6:06, we've got about another 50 something minutes. In that time, drop your questions and hopefully I can answer them. So previously we've had questions about interview experience. What are the best ways to kind of prepare for interviews? A few times I've mentioned the interview book, the interview book that's called the ISC Medical medical school interview book. I think it's not original at all in that sense, but it's a very good book. So we've mentioned that a few times. We've been able to troubleshoot a few difficult questions that you guys find in interviews, like ethical questions, which even for me as a final year med student, I find tricky. So don't worry about that. And of course, we've spoken about personal statement stuff. We've spoken about worries of Ucat and Bmat for people who are about to start, resources of that sort. So anything that you have, feel free to drop below. We've spoken about the medical school experience amongst having being in the COVID pandemic as well. So if you want a little bit more of an insight of how that is going, feel free to ask. It's good to know because I think at this point COVID may be around for a little bit more, even for people in the next year or two, if that. So it's good to know about how the healthcare system is adapting, how medical education is adapting, how you as a medical student will be received by the universities when you go for it. So a few things there. Thank you for joining us, Simona, Ashwini. Hey, Roshan. Thanks for coming back. Hope things are going well with you. Some great news from Roshan last week where she got into med school. So that's always a good news story. That's brilliant. So Ali's question that they've asked is long time volunteering necessary? This is one of the only questions I'd say yes, almost 100% you should. So it's more a long-term activity that you do, whether it's volunteering, work experience, just like getting involved in something, like let's say you were a prefect or something and you had something on for like every week or every fortnight for a couple of months to a year. Basically, a lot of medical schools in the last decade have started looking at not just you doing work experience for the sake of it, but they want to see commitment from you, and that's the value they want: commitment and dedication. And want to see if you can stick to something that's useful, that you can take things from. And one of the reasons why is maybe because obviously medical school is 5 to 6 years long. That's a long time. So that's one of the reasons why to always think about. Would well-being mentor count? I think it could count, yes. You could almost frame it as I volunteered to be a well-being mentor in your personal statement, and I've been doing that. You have to mention this time frame in your personal statement. You have to say, like, I've been doing it weekly, I've been doing it fortnightly, I've been doing it monthly. You don't have to say for the past year and something, but you just need to say I do this weekly. So a commitment that you've had. So Ali, hopefully that's answered your question. I think you've got something there already that you can use in your personal statement. So that sounds good. Brilliant. Okay, let's see the next question. So Leah has gone, would you recommend any places to do volunteering right now that would impress universities? So yes, I would recommend doing volunteering with befriending schemes. With Age UK had some volunteering roles in the first pandemic. Basically, it's just you sitting at home and basically calling people who feel lonely or don't have many people around. Age UK obviously do it with elderly people who are isolated, especially those who were shielding for the past year. And so that is a way of you kind of engaging with a population and trying to help. And that's what they want to see. Those are the qualities that they want to see in a future doctor, someone that can make a difference. And so I'd encourage you in the pandemic era to take up opportunities like that. There are very exciting opportunities as well, but I think that's maybe post-pandemic, is that I remember if you go to your local council's volunteering like website or charity site, there's loads of volunteering opportunities that they need you to help out with. Whether that be, for example, I saw some where you could help with kids who are young carers who go on weekend retreats to kind of take a break from the day-to-day work, and so you can be one of those volunteers kind of helping on those weekends and just making that weekend a good experience and organizationally better as well. So those are amazing opportunities. I'd encourage you to look at your local government or council website for volunteering or charities. Just like put that in on Google. That's what I did like 5-6 years ago, and I found some stuff. And then take it from there and do what you're happy with. Hi, thank you for joining us, Natalia, Dina, Amy is back. Hey, hope you guys are doing well. Drop your questions below. We've had one or two come in, but not that many so far. But yeah. So I'm having a look. So in terms of medical stuff in the news recently, do you guys want to drop on the comment section below a recent news article that you've maybe read regarding medicine or like the health or healthcare in general, just like maybe the topic, and we can maybe talk about that. Put your views down as well whenever you get the chance on the comment section. I'd be interested to see what you guys have been reading. So I'm starting to revise for my finals exam. So I'm starting to get out of the loop of staying on top of current affairs. Obviously, everything COVID related and vaccine related is all out there still. So I want to see what you guys are thinking of that as well. Yeah, so go for it, guys. Drop your questions below. Drop your comments below. Last week we had conversations about the EPQ. That was super interesting. Even though I've never done one myself, we had a lot of help from everyone in the comment section. Talking about their experiences and what their thoughts are. And I learned a lot from you guys about what, if I ever did an EPQ, what it would mean for me. Closest thing I've done is a dissertation. So that's in my BSc year, in my third year, I studied global health, which was super interesting, something I'm really passionate about. And I wrote a 10,000 word literature review dissertation on maternal health, which was my topic of interest. So I've got some sort of experience, I think. But yeah, you guys go for it. Cool. All right, question for you guys. Have you guys thought about BSc options for medical school? And if you'd like to take up any BSc options at all. If you've thought any were of interest, drop them below. I want to see what people are looking at. Cool. Leah, I hope I've been able to answer your question there. Right now, that would impress universities. Brilliant. Ali, if you've got more questions, drop them below. Thank you for those so far. Hey, Paulina, do you have any questions? If you do, drop them. Anisha's joined us. So has Sophie and Manara as well, which is brilliant. All right, I'll wait some. Oh, okay, Amy, you got something tasty there. I see plague. I saw something about a plague outbreak in the DRC. Ooh, right now I think around 30 people are dead. Whoa. I've heard about the plague as well recently coming about in that area. Yeah, that seems a bit crazy that something like that can happen in 2021, right? When we'd left the plague, God knows when, how many centuries ago. So yeah, I mean, what I see from my background, I can see that health systems are super important, and the reason why health systems can flourish, one of the main factors is by having stability in a country. Hence, having no war or conflict makes a huge difference for a country to progress, whether that be economically, which then links into in terms of the healthcare environment. Like, it's super important. And I think in the DRC, what we've seen recently is politics, terrorism, and other conflict scenarios kind of go into the mix and cripple that healthcare system so much that we've got to the point where we've got an outbreak of something like the plague, which is crazy. So, yeah, madness, absolute madness, but very interesting to read upon. All right, so thank you very much for your question, Dina. So Dina's question is, hi, does revising for UCAT prepare you for Section A in Bmat? My short answer to that is no, unfortunately. So I think the problem with the UCAT and Bmat exams are that they are very difficult in terms of examination technique, and it's all about kind of being on top of that exam technique in order to do really well. And you can fool yourself in thinking that there are some similarities and maybe there's correlation between how well you do in Bmat and UCAT, but we don't know if that exists or not, and the actual sections themselves are distinctly different. So Section A is very much about aptitude, I'm guessing. Section B was about science and maths. And the aptitude, it does use some skills that you used in the UCAT, but it's an entirely different format of questions and difficulty level and the way they ask it and all of that stuff. So in short, no, revising for UCAT does not prepare you for section A in the Bmat, but it does prepare you to realize how tricky some of these aptitude questions are. And on a side note, actually, I was always kind of angry that we had to do the UCAT and Bmat, these aptitude type tests. Didn't think they had anything to do with me being a doctor in the future and stuff like that. And I too think that I don't think UCAT and Bmat make any difference on what type of doctor you're going to be. I think it just makes a difference to these medical schools to differentiate you guys as candidates, because so many of you guys are getting good grades like A's and A stars in A levels as well as GCSEs 8s and 9s. So it's just to differentiate you guys. But I do see that every kind of career path after you finish uni ends up having these similar aptitude tests to do, and they're more trickier as well further down the line. And so if you do it now, it really does set you well for like things outside of medicine as well when you apply for jobs. There's loads of aptitude tests like UCAT, Bmat type stuff later on. So you'll be good to get ahead. So, hey, thanks for replying through the comments, guys. So let's see what you guys have been talking about. Amy goes, no one else I know is considering IBSCs right now. Oops. But Imperial or UCL for cardiovascular, reproductive women's health, or surgical. I think that's just ICL though. Would be amazing. Amy, that sounds super interesting. I know a few friends at Imperial that have done the reproductive women's health IBSC. They've really enjoyed it, and it was wicked. Like I remember that they just loved it. They loved ONG, obs and gynae and stuff like that, and so they really thrived in that. And cardiovascular sciences at Imperial is world renowned. I know a few friends that actually went from King's and other medical schools just to Imperial for that BSc. So don't threat, even if you don't go to one of these med schools, you can always still go to do a BSc in UCL Imperial, wherever you want to go. So one way or another, hopefully you'll get there, and keep that in the back of your mind. I've mentioned here before actually that I had a GC. During my interviews, I told them that I wanted to do my BSc in global health at UCL, and so that was it was nice to kind of fulfill that 2-3 years down the line. But yeah, that's that. Good luck with it, Amy. I think those are two wicked BScs. Surgical is pretty cool as well. You'll have loads of fun, I'm sure. Brilliant. All right, so Roshan goes, in terms of recent reading, I have been reading and attending virtual events about the harm reduction service in Glasgow. Ooh, really interesting to look into and definitely worthwhile learning more. All right, so harm reduction service. What does that service do, Roshan? Like which sector is it working in exactly? I'll be interested to hear. And I actually, after this, I maybe take a little Google search and find out about what's going on there. During my global health year, we spoke a lot about Glasgow and kind of like Scotland in general in terms of social determinants of health. That's like a type of model that we use in medicine and like global health to tell us and inform us about how societal factors and lifestyle influence our disease processes and burden of disease, which I think is very important for us to know now, as COVID is basically extenuating that circumstance of the divide from like rich and poor and stuff like that. But yeah, so loads of interesting stuff. Glasgow's amazing. I think Roshan said you are going Glasgow, aren't you, for med school? So that's wicked. Loads of research going on there. So I'd encourage you to get involved when you finally get there. Should be good. Cool. Let's have a look. And Roshan's gone, if I did undergrad med, then would be interested in global health, but the offer I got doesn't have the option for IBSc since it's postgrad yet. That's a fair point. You've been in education for a little while, Roshan, so I think you can just speed through med school. You've done the hard part. I think you've got plenty of opportunity, though, in the future to do masters and diplomas in something that you're interested in, like global health. So definitely look into that. And when you're at medical school, you'll probably get loads of opportunity to get involved in research. So if you just go up to a few people in the global health department, I'm sure they will start talking to you about things that you can get involved with, which will be fun as well. Glasgow's got a world-renowned global health department. Wow. Yes, so Bodybound Studios goes, if we get a place, I'm just waiting for replies to interviews. what resources would you say to use to prep for med school first year, like Ninja Nerds, MCAT, Khan Academy? Bodyband Studio, that's a very good question, and I'm probably not the best person to answer that right now. All I know is that, like, I'll tell you what I did. In my first year, I didn't know Anki existed, um, because Anki wasn't such a big thing as it is now. And I hear that all the first and second years use Anki, and I only started using it like 2-3 years ago. So that tells you a lot. So I'm guessing Anki will be one of your first things. And in terms of stuff, Osmosis is a YouTube channel that's super good for stuff like for resources that will help you for med school in general. And there's loads of audio stuff coming out in terms of audio med ed content. So I know a few people that scrubbed in who have kind of got an audio content channel with doctors talking about cases that are to do with medicine and teaching you through pod cases. That's super interesting. So look out for things like that. I know there's Osmosis, there's QuesMed, who are a question bank. PassMed is what everyone uses in clinical years, especially that's a question bank. But I wouldn't worry. Like honestly, I wouldn't worry at all about first year. You get there, and then you find out from elder years specifically how to get through that medical school and what resources to use. Because you'll be surprised at the differences between all med schools in terms of the way they examine and what type of content specifically they examine at. And so therefore the resources we use are kind of a little bit different. So for example, I know in some med schools they just use past medicine as a question bank, and that suffices, and that's the level of questions they get. But I know at UCL that past medicine questions are almost too easy compared to the actual exam questions, which are 2-3 times harder. So we have to use other question banks like QuesMed, and then more difficult question banks from like Oxford Handbook and things like that. These are things I wouldn't know about, and for other med schools, but when you talk to people in elder years in your med school, I'd encourage you to form those connections and friendships like early on, because that's your network that would really help you. They also pass down loads of notes from years above, I'm sure, and lecture stuff so that you can get ahead of the game. So in my opinion, to get ahead in first year, I would wait until I get into first year. Then after that, I would network and meet a few people in years above. Hopefully they'll give you good advice and tips specifically to your course. And then from that, you can use the question banks that they'd recommend, and use notes that people have passed down or taken from other like resources, and or like made or use like textbooks specifically. And that's what I did. As soon as I go into first year, I made a few friends in the years above, and they've helped me through the last 5-6 years of med school. And that's a good bond to have. So make sure you guys remember that when you guys enter first year, to make those friends. Cool. Thanks, Amy. 18-year-old would be so proud, very much so. Yes, so it's a safe injecting site in Glasgow. Wow. Okay, so Roshan is now explaining the harm. What's the project's name? Sorry, the harm reduction service in Glasgow, which is to do with safe injecting sites in Glasgow to help reduce the number of drug-related deaths in Scotland. Wow, that is super interesting, and that's something I've actually come across before. So Canada has this service in Quebec, from what I remember reading in my global health years. Loads of controversy around it, because obviously drugs is a very dirty word in society in general, and negative word, but it's a debate worth having, and safe injection sites are super interesting to talk about, because actually a lot of harm that comes about from IV drug use is from the diseases passed through the injections used, and that obviously then falls upon the medical facilities like the NHS to kind of deal with in the long term. For example, you could be getting hepatitis B or C from a needle, you could have got HIV from it, and obviously that's because you're injecting drugs. However, if you've got a safe injecting site in an area where you can go to do those drugs like that, it almost sounded counterintuitive to me when I thought about it, almost like we were encouraging drugs. But actually, if you look at it from the alternative flip point, it's the perspective that it's the principle that actually these people who do take drugs are the victims of drug abuse and drugs. Like they now are at a point where they need help and medical intervention to get them out of it and to limit the harm that they get. So there are a lot of connotations, loads of things to talk about there. Hopefully I've just started talking about. But yes, of course, yeah, Edinburgh's got a wicked global health department. And I think I think what's her name? Devish Srijast? I'm not on Twitter at the moment. So like one of the Scottish doctors who's been talking about COVID a lot. I forgot her name. The British American one. She's really great, and she's I think in Edinburgh, isn't she? So wicked. You can meet people like her, which will be fun. Brilliant. Cool. So yeah, Roshan goes, yeah, the person who set it up privately has worked with the people in Canada and Denmark. So went and visited the site in Copenhagen. Oh wow. Seems like a lot of doctors are involved in the Copenhagen one. Okay. So the Copenhagen one has become big then. That's super interesting. Roshan, what are your thoughts on it? What do you think about the safe injection site? Were you as surprised as I was when I first came across it? And do you think it's going to be of benefit? Cool. Let's talk. We've got some questions coming in as well. So, Amy, I'll answer your question on the Quest card in just a second. Let me get yours on the comment first. Have you got any UCL interview tips? Going off where I'd apply right now, it'd be my only traditional interview, so I'm not too sure how to tackle it. Amy, I wouldn't promise you that next year UCL will be a traditional interview med school. The reason why they stayed traditional this year is because they had, obviously because of everything's online and over Zoom. So it was a very difficult year for them to transition to MMIs. It would have been too much hassle. But I remember last year when we were doing interviews, there was a lot of talk that they might go into MMI, especially because Imperial started doing it last year. So for your interviews, it could be either or. We'll see when it comes to it next year. If it's in person, I think they might convert to MMI by then already. In terms of traditional interview stuff, I think it's very much more relaxed than the MMI interviews. They don't ask any scientific questions. They want to know about you and your personality and how you think about problems. And so, Amy, I'm sure you've joined us for the last few weeks, so you've seen how we talk about critical thinking, debating both sides of an argument, adding your work experience and your reflections to that being pivotal. Those are the really key things that they take away for the UCL interview. And hopefully, closer to the time when you apply, we'll be here on Medmentor to help you out with any further tips specific to that time. But yeah, in general, it's a friendly interview, and it's all about the stuff that we're talking about here, that they're looking for in terms of qualities of a person. Nothing untowards or special compared to all other med schools. Yes, Prof. Devi Sridhar, she's based in Edinburgh indeed. So when you see Prof. Devi, please say hello to her from me, even though she doesn't know I exist. But that's someone I definitely want to meet someday soon. She is super amazing in the way that she's worked through this pandemic in terms of getting the public message out there and criticizing politicians and MPs. It's been very interesting to see a public health figure really go out there and tell the government, no, this is wrong. Unfortunately, no one listens to her. Well, not enough, but the Scottish government certainly do, which tells you a lot about how their handling has been, which has been probably much better than England in terms of the virus. I'd actually listened to her this morning on a podcast that was done. It was to do with how to change the world or something. It's the Channel 4 guy that does the podcast, and she was on it, and she was really, really good. So definitely recommend you listening to that as well. Cool. I think it's amazing. Brilliant. So Roshan really likes the safe injection site zones. I think it's amazing. There is an outbreak of HIV in Glasgow. Oh, wow. Highest number in over 30 years. So that is such an important service. So yeah, in terms of the timing of this intervention, then it's super important that they get on with it. So that's wicked. Roshan, so Scotland also has a similar number to the US with regards to drug-related death. So it's definitely needed here to support these people and to get the help they need in a safe environment. Yeah, Roshan, the Scottish healthcare system is a very interesting place. So I don't think I mentioned here before, but I was very, very close. I was like this close to applying to Edinburgh. But my mum made me apply to UCL basically. She was like, how can you not apply to a London university when you live in London? Like, do you want to run away from me so badly? So that was the only reason why I didn't apply to Edinburgh for med school. Obviously, I don't regret it, but it was, I looked into the Scottish NHS because I was set on applying to get my head around it for interviews or for my personal statement because Edinburgh didn't have interviews. But yeah, so I didn't realize the obesity rate was so high, and in Scotland, because I associated Scotland as a Londoner to kind of like, yeah, outdoor spaces, village environments. There are towns and cities, but they're not going to be as cramped as like central or East London and stuff like that. Which is very interesting to find out that the social inequalities of health really do push to the limit in terms of Scotland. Yes, Roshan Gus can go to Scotland for your FY1. I'm sure your mum would understand by then. Yeah, maybe so. At some point, I'm sure I'll go live in Scotland for a couple of years. Definitely something almost on a bucket list, just because I'm so intrigued. I think being in the same kind of country, being in the UK, there is a huge divide though in terms of how things go and like in terms of cities and towns. So yeah, but yeah, brilliant. Super safe environment. Yeah, a safe environment is definitely needed. I did not know that the US and Scotland had such similar drug-related deaths. That's crazy and stuff that doesn't get talked about enough, I think. And people down here in the south of the UK, I think you guys have always heard like we don't hear about anything that happens in Scotland like that. The fact that you guys that resources need to be put in and public health interventions need to work there as well, because obviously we're Public Health England focused and the news is focused to South England as well. But yeah, very complex, interesting research with geospatial mapping to show the disparities. Yes, indeed. I think when so Michael Marmot is a lecturer at UCL, and he has done a lot on this type of work and has talked a lot about Glasgow in the last decade or two. And things I think have improved in Glasgow, for example, within Scotland. And yeah, it's just a very interesting kind of like field to look into. Very, very complex. You're right. The reason why the death rate. So for people who are confused about why I'm talking about Scotland and Glasgow and stuff like that so much is because I'd encourage you guys to look at the social inequalities of health model and social inequalities of health in general, because it is more important than ever before in a COVID time to find out what that is and how those things impact health, because it's impacting health right now and will do for the next 10, 20, 30 years, even more so because of this COVID pandemic. So definitely look into that, guys. Get yourself educated on it. And it's something really, really cool to talk about in an interview if you get the chance. Something I only came across when I was in my third year of med school when I did a BSc. And for example, the reason why I say this is because I think there was in 2010, there was a survey out and there was data out there that within the UK, there was a disparity of like 15 to 20 years of life expectancy between one area of the UK and the other. One of the areas of the UK was Glasgow. Their life expectancy was like 72 or 73. And the other area of the UK was south of England in Bournemouth, some super rich area where the life expectancy average was like 84, 85. So that's it. So like just because of where you live in the UK, you could have 10 or 15 years of your life wiped off on average. To put that in context, the life expectancy right now in Palestine was about similar, like 72, 73, or even better than Glasgow was at that time. So that's a developing country, is war torn in conflict areas, and that tells you a lot. And everyone had put it down to because everyone in Glasgow eats loads of fatty foods, chips, and Mars bars. But it was very much more complex, and it came down to moving communities and breaking those communities up through Margaret Thatcher's era of government in the 1980s, which then has led to 20, 30, 40 years later, healthcare being healthcare kind of being disrupted in terms of preventive medicine and lifestyle. Anyway, so that was my TED talk on the social inequalities of health done there. Sorry about that. If you guys are interested in stuff like that, do drop a comment below on what you guys think of it. I see there are questions that have come in, so let me address them. So Dina, thank you for asking your questions on YouTube. So let me just answer yours first. So Dina goes, some interview questions give you a scenario where you as a doctor have limited resources, example, one course of antibiotics, and give you a list of patients, a patient with HIV, a mother with 2 kids. Wow, this is looking difficult? How do you decide and how do you structure an answer? No, Roshan, thank you for your comments. It makes it more fun, I think, when we have these little debates. So that's brilliant. So Dina said, yeah, give you a scenario where you as a doctor have limited. So Dina's scenario is an interview question that gives you a scenario where you have a doctor with limited resources, example, one course of antibiotics, and you give a list of get a list of patients, a patient with HIV, mother with 2 kids. How do you basically decide on one of the options, and how do you structure your answer? So what I'd like to say, first of all, with these ethical questions, they don't really care about what your answer is, because it's never right or wrong. What they care about is you justifying your answer, Dina. In order to get to that answer, they want to see the debates that you have and the structure you go through. The structure you go through should be one where it's like for and against each of the options, and I would include the 4 pillars of medical ethics as well within your answer. So like beneficence, non-maleficence, justice, maybe even autonomy in a certain sense, and see if you can apply that and then say for and against. So for example, should I give this antibiotic to a mother with kids? I can say that from the information, I don't know if the mother has any comorbidities, so I don't know if she needs them as much as a HIV patient. A HIV patient might need antibiotics more because their immune system is compromised, so therefore they need the intervention earlier, quicker now, in order to not die. Whilst a mother with 2 kids who might not be immunosuppressed, they might be fine for a couple of days to weeks without the antibiotics and might not die because of it. Like, you got to think of those type of circumstances, and then you got to work on principles. So you need to make assumptions, you need to ask them questions like, actually, or state that actually I may not have enough information to answer this question. And often you don't have enough information to answer these questions, because those questions are asked to hospital ethics boards with loads of information per question, per patient and stuff like that, and loads of research that they use, and then they come to a conclusion with like 6-7 other people within a group after they have a debate. So these interviewers aren't relying on you to solve this, they're relying on you to think it through. And at the end of your answer, I would come out with a conclusion. All in all, I think that it should go to this person because of this reason and my assumption, even though the other 2 options are very strong. That's just my opinion. However, I would caveat that by asking, obviously, I wouldn't be in a position to make that choice, but I would refer to the consultant or the ethics board of a hospital that actually makes those decisions. So that's like the end part of your answer. And hopefully, yeah, that has helped you, Dina, to look at principles, to look at medical ethics, like the principles being, oh, do we want to treat someone and limit death or limit the morbidity that they have, so like illness, or do we want to limit impact on people's lives and how many people will make a difference to? So for example, if I go through the principle of to give antibiotics to a patient with HIV or a mother with 2 kids, if I go to the mother with 2 kids, my leading principle will be based on the fact that the mother with 2 kids has 2 vulnerable children that she needs to care for. Therefore, this antibiotic would help her, but also help 3 people as opposed to the 1 person who has, for example, a patient with HIV. I would then go for that. Like, that's a justification to an extent based on a principle. Dina, I hope I've been able to answer your question there. I've never had interview questions as difficult as that, so you guys are almost grilling me with them, but hopefully that's helped you out. Okie dokie. We've got a question from Amy. Let me just check if Amy's still here. Yep, Amy's still here. So, are the timings for the Ucat set, or is it a guide so you can go back and forth between the sections? Really dumb question. I know. I'm sorry. No dumb questions. However, I'm not too sure. So, does anyone know the answer to this question? If you do, drop your answer below. Are the Ucat timings set for each section, or can you go between each section? Actually, from what I can remember, 8 years ago or 7 years, I think I'm adding more years to when I actually applied. It's like 7 years ago when I did the Ucat, you had to do it with set times, and you couldn't go back and forth. Yes, Roshan has confirmed that. So, and I'm sure Roshan has done that recently. So yeah, you can't go back and forth. That section is that section. I'll tell you right now, the UCAT is the worst exam I think I've ever done. Until I got into med school and there was a very difficult anatomy spotter exam. But in the UCAT, honestly, I was just like praying to God and just clicking buttons at one point, because for about 20 of the questions in a section of 30 or 40, I just didn't have enough time to read through and answer them. So I just went, click those answers. So yeah, you're very welcome, Dina. If you've got any other questions, do drop them below. That was a wicked question. But you improve with practice, definitely, Amy. Thank you for that. Definitely, practice makes perfect with UCAT, or not perfect, but makes a difference, which is good. All right, so Larsai, I think, has left, which is unfortunate. But I will answer their question, and hopefully they can see it. Guess and flag is your best friend. I don't even know if flag is worthwhile, Roshan. I don't think I've ever gone back to a flag question on the UCAT in my life. Don't worry though, your SJT is going to be fun, so you can keep those tactics for then. Oh, do you think studying medicine in Ireland, specifically RCSI, is a good idea? So this is a question I've gotten recently as well, about studying in Ireland, and I don't know if it's a good idea or not. I think go for it if you've done enough research and you've maybe tried to get in contact and speak to people in Ireland, but just know to find out if you need to do exams to come back to the UK, to work in the UK NHS. A lot of international medics have to do a PLAB exam, which is like an entrance exam that is very, very tough. And you have to do 1 year of like training before you can enter the foundation program and stuff for medicine in the UK. So see if those rules apply before you apply to somewhere like Ireland. Because I know it's in the EU, but I don't know if there's any exceptions in terms of how it works with all of that. Brilliant. Okay, thank you guys for joining me today. So I've got a few more questions coming in. If you guys have any more questions, drop them below. Ireland is really good for unis, but you definitely need to do the plan for GMC registration. That's just extra pay. All right, Amy. Thank you for that. Did not know at all that was the thing. So wicked. Yeah, Ireland, interesting. I actually knew someone. Well, I didn't know someone, but I heard the story that someone applied to Queen Mary because they lived in London, but then they had accidentally applied to Queen's in Belfast, in Ireland. That was fun when they had found out, and they only found out when they had an interview when they applied there for medicine, and they're like, "Oh, why are they telling me to take a flight? Like, what's this about?" And then they realized they applied to the wrong Queen's or Queen Mary. So don't make those wrong decisions at any point, guys. Cool. So next question I have is from YouTube. Is it worth doing the Bmat for only one university? Yes. Or is it better to divide 2 and 2, do UCAT for 2 unis and Bmat for 2 unis? Yes and yes. Is it worth doing the Bmat for only one university? Yes, I do think so. And I think it is still good to divide between UCAT and Bmat. But it just depends where you want to go. Okay, I think, Noor, your question here is just based on where do you think you have a better opportunity to get into for med school, whatever your application plays to their strengths, and if you like that university or not should play to your hands. I have heard of apply to 2 UCAT, 2 BMAT, and like spread your like eggs or something so that you can get in. Don't count be, yeah, I don't know. Basically, whatever those sayings are, basically you want to spread the risk, basically, is what you're saying. However, you do the UCAT before you apply, so you know if you've got a very decent score or not. So if you're getting 500s, then the UCAT isn't a safe bet. If you're getting 600s, depending on the year group, what that score means, you can see from the centiles and see if you're in the top 50% or you're coming in the bottom 50%, and then you can see if you want to take more of a risk with the BMAT or not. So what I'd say is either way, it doesn't make a difference, Noor, because you get your UCAT result early on and you get to find out how well you kind of did before you apply. And so you should use that to make your decision. Because after the UCAT, because UCAT universities still look for the same type of things as other med schools. or similar things. They just use the UCAT obviously instead of the Bmat. That's all it is. No, Amy, they didn't eventually go. It's an absolute mess. But I didn't know the person personally, but I remember our teacher talked to us about it when they was going on. I had a friend who forgot to sit the GAMSAT for a GAMSAT. Oh, you hate to see things like that. These things happen more often than we realize. Yeah, this is why we've got hopefully Medmentor around and other people and like support systems in place to tell you what to do when to help you out. But yeah. Noor, I hope I've been able to answer your question there. So yeah. Now, luckily they got an offer for a UCAT uni and had to withdraw from the other one. Oh my God, that's such a mess. Roshan, did you do the UCAT and the GAMSAT? Just out of interest. And how was the GAMSAT if you did do it? But yeah, cool. All right, so just having a look, and I think those are the questions that we've gotten. So before I do go, if you've got any other questions, drop them below right now before I go, and so I can answer them and whatever, which is cool. Hey, yeah, that's brilliant. You're very welcome. No problem at all. So I'll be back next week at 6 p.m. As well to do these Medmentor sessions. Just a UCAT. I didn't think it was worth the £275. Yo, Roshan, they are rinsing postgrad students. They're already rinsing the undergrad students as it is. But postgrad students are having it the worst. So, wow, good on you of getting in, man. Because that is madness. If I didn't get in this year, then I would have. So I could apply for the Scott Gem course. That's fair. Body Band Studio, you're very welcome. No worries at all. But yeah, so guys, let us know what you think of. Let us know what if you have any other questions about medical school, life as a med student, things in general. Drop them below. Last call of questions in the next 5 minutes I'll take out. So what I'd like to say is Medmentor, what we try and do is kind of help you guys get into med school through blog posts, through resources that we post on the website, through giving you guys advice and having sessions like this where we can kind of troubleshoot your issues. So what we'd really value you guys to do for us is just reach out to your friends and family that you know applying to med school or know of people and kind of share us with them, because it'd be really great to get them onto this resource to see what we're doing. We want to get our work out there to as many people as we can. And so that will really help us out. So please do share us with your friends. Yeah. The other thing is we've got a new function on our website under blog posts where you can actually comment on blog posts, see what you thought, tell us what's going on, like what your comments are, and we can reply and we can have a debate there as well. So definitely check out our Medmentor website and our blog posts there. And we've got a Twitter page, we've got an Insta page where we post regular like kind of vlogs, and there's a vlog series coming very soon. And reels and stuff like that, so you can see what life is like as a medical student / doctor, hopefully in the future, things like that. Loads of things out here that we're creating content for you guys. The team are working really hard, and we love having feedback from you. So do let us know if you can help in any extra ways as well. We'll try and go above and beyond. Like a lot of everyone in Medmentor really are passionate about kind of widening access to medicine. So that's why we're here. But yeah, and I'd encourage you in the future when you do get into medical school yourself to kind of get involved in things like that and help in terms of widening access. Roshan, thank you for your kind words. Super glad to hear. I know, I mean, I'm thinking about it now, 6-7 years ago when I was applying to med school, I would have loved to have something like Medmentor around as a resource to know what was going on in. I never even spoke to a medical student before that, before I entered med school. So that would have been an insight on what I was looking forward to, things I could do to help me, just like in general. So yeah, I would have found it useful myself. So I'm glad that you did now, even though at the start we weren't there. Amy, don't worry, we'll be here to get you through every step of the way. Hopefully, we're growing a little community, and we'll see everyone kind of go through the process. We've already got Roshan in med school, so we'll hopefully see her on a few lives here or there and see how she's finding life as a med student. But yeah, Amy, I'm guessing you're applying in the next year, or maybe a gap year or whatever. So like good luck with all of those, but we'll be here always for you. Yeah, the money is wild. There is a lot of hidden costs. Yes, I think medicine in general, there's just so many barriers to entry most of the time. It's crazy. It doesn't make any sense. So yeah. All right, guys. So that's the end of our live session today. Hopefully, yep, applying for 2022 entry. Yes, wicked. Yep, we'll be here. Hopefully to help you through. But yeah, if you guys have any questions that you think of throughout the week, make sure you keep them on so that you can drop them below later on, and we can have a bit of a conversation about them. Any debates or anything you want to have. I think next week is going to be kind of the end of February. Loads of people are having like last few interviews, and people starting to think about UCAT and Bmat prep, and so feel free, and personal statement work and things like that, feel free to drop them, and we can have a look. You're very welcome, guys. It was good chatting to you all, and I'm sure I'll see you next Saturday. All right. So take care of yourselves. Enjoy your week, and bye. Bye, guys. Dun, dun, dun.